Wesley Deters reporting live with Bulldog Media on Burnett Avenue and between Children's Hospital and UC Hospital. I'm here with a gentleman who is very emboldened and impassioned with his stance today with the protest against mandatory vaccinations among the Tri-State Hospitals. Sir, what's your name?
My name's Greg Ellington.
Tell us a little bit about yourself.
Yeah, so I've had the honor of being a pharmacist here at UCMC for the last 9 years. After graduating up in Indianapolis, I was fortunate enough to get the job down here and be able to serve for the last 9 years.
Great. So tell us why you chose to go into the medical profession.
Yeah, so my biggest hero is actually my mom. I was raised by a single mom that's been a nurse for over 40 years now. And I was always inspired because my mom would work 5 and 6 12-hour shifts a week and raise me and my little brother. So she would come home after caring for patients all day and would put a warm meal on the table. And I don't know that there's many people that have enough strength to do that. So that was my first example of what a true healthcare professional really looked like.
I think that's amazing. So talk to me a little bit about, you've had this example from your mother as a medical professional.
Yes.
You've chosen a similar path in your own life. What does it mean now that you're experiencing this decision to have to be forced to choose between biological autonomy and your livelihood?
Yeah, I think it's a really, really hard position to be in, Wesley. It's heartbreaking first and foremost because there's sweet patients that we have the honor of serving, that if this crumbles, they're going to suffer the most. I think you have a lot of individuals such as myself that are willing to transition to a different career field and go into a different industry. That's not ideal, and it is a little scary. It does induce some anxiety. However, this is so important to us that we're willing to go to those lengths if necessary. So yeah.
Can you speak a little bit more to the consequences of this fallout? If we see all of these healthcare professionals, thousands and thousands in the tri-state area, get fired or choose to quit as a result of this forced vaccine, obviously the first thing to suffer is going to be patient care.
Yes.
Can you speak to that a little more? Yes,
ma'am. I can tell you right now that we're already experiencing a pretty significant staff shortage. That's in the pharmacy where I work, as well as up on nursing units. My brother-in-law is a traveling nurse right now, and they are paying him exorbitant amounts of money to come in and cover these shifts that are not covered. So what's going to happen when not just 10%, but say 40% of the city's healthcare staff are now ineligible to come to work and to continue being the heroes that they've always been, you are going to see a significant fallout, where, as you alluded to, patient care is going to suffer significantly, and that's going to be heartbreaking.
And that's just one of the consequences that we wanted to speak to today. I mean, obviously we've got thousands of families that will be affected, their livelihoods, their income streams, everything is at stake here. Not only that, we're fighting for the right to choose our own health. We're fighting to choose whether or not we're vaccinated. We don't believe that this is something that should be mandated by the government on us, particularly while it's still under emergency authorization. Can you speak a little bit to whether or not you will see a shift internally if this gets FDA approval in terms of acceptance among the employees?
I think that there may be a little bit more acceptance because, as you said, right now it's just an emergency use authorization, which technically cannot be mandated legally, but normal FDA approval process is roughly 10 to 12 years, and at 5 years, if it's done in 5 years, that's considered lightning fast. So if you're talking 12 to 18 months for an approval, that's still going to be met with some resistance and a lot of scrutiny, and I still think you're going to have a large contingency of people that are going to still reject that and not be okay with that being made.
One last question for you, Greg. So
yes,
we've done a total 180 as a country over the past year.
Yes, ma'am.
Well, last year at this time, we were glorifying our healthcare workers, and we were so grateful for the sacrifices that they were making on a daily basis. Those were our frontline heroes.
Yes.
Today, those same people are facing medical tyranny within the workplace.
Yes.
Can you speak to that?
Yeah, I think it's difficult because you have people that, personally in our department, we were doing 7 on, 7 off, where we're coming in and putting 10 to 12-hour shifts in for a week straight, and most of us weren't seeing our families. You have people that were even staying in campers outside of their homes and not seeing their little ones. It was difficult. Fortunately, I didn't have to do that. but I've watched people across the country. If you watch any news media outlet, it doesn't matter whether it's leftist or more conservative, it doesn't matter. You're just seeing a wide range of suffering. And to have, regardless of how people feel about the vaccine, you have a lot of healthcare workers that are not going to have the opportunity to continue serving in the fashion they feel called to. And so I think that's heartbreaking. So.
Well, we appreciate your time, Greg. Do you have anything else you would like to share with the audience before we sign off here today?
Just thank you for the opportunity to voice an opinion.
Thank you. Well, this is Wesley Deters reporting live for Bulldog Media, where Americans fight for America.